wisdom tooth removal. So let's start. So first of all, wisdom tooth removal can be done by a normal dentist or a specialist surgeon who is attached to a private clinic or a hospital. Next is uh, how does the dentist determine whether your teeth wisdom tooth has to be removed or not? They take an X-ray and then they check the shape of the roots. They check whether it's mandatory to remove the wisdom tooth or not, whether there is an opposing tooth in the lower arch or upper arch. In the opposing arch, if there is a tooth opposing this tooth, then it is not mandatory to remove it. It can be repaired, but otherwise, if the tooth is too bad and that it cannot be restored, or there is no opposing tooth, then it's better to get rid of it rather than causing a long-term problem. Okay, so let's start with the procedures. What all things go about in removing the wisdom tooth. First of all is the anesthesia part for the procedure of the wisdom tooth removal. For the anesthesia, for the anesthesia of the wisdom tooth removal, you will be given an injection of local anesthesia to numb the tooth and the surrounding areas. Okay, then the the area will become numb, and you will not feel anything whatever procedure is carried out in your tooth. Also, patients who are very anxious or scared, they can be given a sedative, or sedative injection is given into their shoulder or hand, so that they feel relaxed while doing the procedure. General anesthesia is given, like full body is numbed, so like patient is made unconscious. That is done in 1 in 10,000 cases, so that patient feels nothing, and the procedure is done painlessly. Okay, so let's talk about the procedure removing the wisdom tooth. Okay, so first of all, whether the tooth is completely erupted in the mouth, matlab, if it's broken through the gum and come into the oral cavity completely or not. If it is above the gum, then there's no need to give so much of a cut and then remove it. But if the tooth is not come out of the gum, then the gum needs to be cut, and then some amount of bone is drilled on the side of it, and the tooth may be cut into sections or pieces, and then it may be removed. Okay. Also, while removing the tooth, later on you may feel some pressure, or the feeling of something is being done. Also, some patients may feel some pain or too much pain. If the tooth is too much deep inside the bone, then the patient may feel some pain. In such cases, what the dentist does is gives more anesthesia and then carries out the procedure painlessly. Next is how much time duration is required for wisdom tooth removal. It can be a few minutes if the case is simple, and around 20 minutes if the case is complicated. Now let's talk about the post-surgery care or after surgery. What all things are to be kept in mind? So first of all, once the cut is given and the tooth is removed, the gum again needs to be brought together. To approximate it together, the dentist gives some stitches to close the wound nicely and cleanly. The stitches need to be removed after 7 to 10 days, for which you need to visit the dentist again. Second is a gauze or a cotton plug, thick one, is placed between the teeth where the tooth is removed, and patient is asked to press on it hard for about half an hour, so that the bleeding stops completely. And patient is prescribed with antibiotics and painkillers. Let's talk about the recovery after the wisdom tooth removal. Recovery of the wisdom tooth removal takes around 2 weeks, in which duration you can experience things such as swollen mouth or cheeks. This reduces with the application of ice or eating an ice cream. The 1 hour post the surgery, after the surgery, 1 hour is critical when you should apply ice or eat an ice cream. Second is bruising of the cheeks, where the instruments have been used to remove the wisdom tooth. Third is stiff jaw, it may be experienced for around 7 to 10 days, which then recovers on its own. Next is pain. Pain may be experienced if the tooth removal had taken a lot of time, or if it was complicated. Then there may be unpleasant taste in the mouth because of repeated bleeding which causes in the mouth, comes onto the tongue. Next is tingling or numbness of the cheeks or jaw. Okay. Now let's talk about self-care advice. What can be done after wisdom tooth removal at home? Like self-care advice is like painkillers can be taken, like ibuprofen or paracetamol. Avoid strenuous activity for 1 to 2 days. Use an extra pillow to support your head on the day of surgery at night while sleeping. And you can have soft and cold food, and do not spit after the wisdom tooth is removed for around 24 to 36 hours. And the better oral hygiene you maintain after that, after the second or third day, the better the healing will be, faster the healing will be, and you will be recover faster. I wish that whoever is getting a wisdom tooth removal would have a rapid recovery. If any other doubts, you can put in the comment section. Thank you.